Hello, everybody. My name is Donna Hagen, and welcome to the Inside View. I hope you've all had a wonderful day and looking forward to tonight's discussion. We are dealing with women's health, and I'll please urge each and everyone online to invite all the women in the house, our young girls, our grandparents, and also our mothers to tune in to this important discussion. Tonight, we are talking about smear test or cervical screening, and also um, something that also that really affects women. That is um, yeast infection as well. So please bring all the women in the house, and let's all partake of this important discussion. And smear test or cervical screening is such a simple test that really detects the health of our cervix. It sounds very 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 simple, but we've had a lot of complaints or concerns from our doctors actually telling us how women do not take this test seriously, and as a result, it's claiming a lot of lives. Is claiming a lot of lives. So please, we don't want women die prematurely of cervical cancer. So please bring every woman on board and let us have this important discussion. And trust me, you come back and thank me later. So tonight, I'm not going to waste too much time. I just bring our doctor on board who has been, such a massive support to the Inside View. And she's no other person than Dr. Zainab. Doctor, yeah, how are you? Welcome to the Inside
I'm
View. Good
good,
evening.
thank you.
Yeah,
Hi,
yeah.
hi.
I can't thank you enough. Considering how busy you are, but you always make time for our women, and for that I cannot take you for granted at all.
My
So
pleasure.
yeah, yeah. So how was your day, by the way?
It was good. It was good. Very busy, but good.
Wonderful, thank you. Yeah, tonight we are talking, dealing with smear test or cervical screening.
Hmm.
For the average or for the normal woman out there who
Mm,
does not know much about these medical jargons, if you
mm.
can actually explain to us what smear test or cervical screening is all about, if you can just yeah.
Yes, of course. So, cervical screening refers to a particular part of the female reproductive tract. So we have multiple parts of the reproductive tract. Let me see if I've got a good picture. Um, so there's different parts to the reproductive tract, including the uterus or the womb, as we call it, so where the baby stays when it's developing. And the canal that comes out of that is the cervix, and the one below that is the vagina. So the cervix is like, I think an easy way to describe it is like it's the bottom part of the womb, essentially. So the tip. So you have the vaginal opening, which we can all see. If you look externally, you can see that. If you insert a device inside and you open it up, then inside you can see the cervix. So the cervix is where you can get some abnormal growth and abnormal cells, and they can later on develop into cancer if they've been left untreated. So the cervical screening is a screening program that exists within the UK, whereby we take some of those cells with a small brush and a speculum that I will talk about a bit later on, and we look at those cells under a microscope if you're
Mm-hmm.
positive for something called a human papillomavirus, so HPV. If you're positive for certain types of that, those tests, so those cells will be tested and looked at under a microscope to see if they're abnormal or not. If they are abnormal, then you might have further tests. So, cervical screening, in short, is to be able to look at lots and lots of women, see if any of them have abnormal cells when we look at the cervix, and then decide from there if any further investigations are needed. And if there is, then further treatment. Just to bear in mind, though, out of all the women that are checked, 90% of them are fine. It's 10% that have a problem that will then need further investigation. So it might be that there's not enough sample. It could be that there's abnormal cells, but they're not terribly abnormal. It could be that they're very, very abnormal, or it could be that they're definitely cancer cells. So there's a range of different diagnoses if there is abnormal cells. The vast majority of women have normal cells. Having said that, about 3 to 4 thousand women are diagnosed with cancer, cervical cancer, in the UK every year.
Wow.
The screening for cervical cancer is estimated to save around 3 to 4 thousand lives every year by diagnosing that early as opposed to later on, because the symptoms are very non-specific. So you might have bleeding, you might have pain, you might have bloating, very non-specific symptoms. And by the time those symptoms are there, it's usually more advanced than if we were to pick it up with a screening test.
Okay, so why is it so important to find? I know you've actually explained to us, where the cervix, actually sits.
Hmm.
As important as this test is, why is it that people don't take it so seriously?
So I think it's a combination of things. So it's misinformation and it's fear as well. So there's lots of different reasons as to why someone might not want to do a cervical screening test. So if we start off with misinformation, so it could be that some people think that only certain women will get cervical cancer. If they've only had one husband or one partner, they assume that their risk is low. But if you've had any sexual contact, so that could be intercourse or any other types of sexual contact, that is enough for you to be exposed to the virus and to increase your risk of developing cervical cancer. So that's one myth. Another myth is that the actual screening for cervical cancer is very painful, and it's something that is undesirable for women and pointless because, again, they consider their risk to be low. It's not a painful procedure. If it's done correctly by an experienced practitioner, so it's typically a nurse that does it. Sometimes you might have a doctor do it in a different setting. It might be a little bit uncomfortable as the speculum is opening, but it shouldn't be painful at all. If it is painful, you can always tell them to stop, and they will stop right there. They won't stop and pull it out, they will just stop. And then as soon as you're ready, they will either continue or they will remove it. So that's another thing. Some people believe that if they are of a certain age, they're unlikely to get cervical cancer. So if they're particularly young, maybe in their 20s or 30s, they think that their risk is low and it's something maybe older women get. In actual fact, about 54%, I think, if my numbers are right, of women under 30 are the group of women who get cervical cancer. The rest is over that. So it's generally fear and misconception that it's a test that's going to be painful, that is unnecessary because they don't fit the criteria. And their risk of getting cancer is low because they've had no family history, for example, or they don't have many sexual partners. So it's a combination of those things. And those things persist within the diaspora. So the African diaspora, women tend to see it as an unnecessarily invasive procedure that confers very little to no benefit. When in actual fact, in so called developing countries, so African and Asian countries essentially, the rates of cervical cancer are quite high, and they're high for a number of different reasons. Each country has their own issues and their own reasons as to why the rates will be higher. But lower rates of detection and later presentation undoubtedly will have an effect on the life expectancy of women who have cervical cancer, and thus poorer outcomes associated with the disease.
Okay, so do we have any cultures that prevent women from, having this screening done?
Yeah, so if you think about African and Asian cultures, the idea of chastity and generally being seen as pure, and that being associated with virginity, etc., there is a reluctance to go for cervical smearing, because they feel like either if they're not sexually active or they are and they feel like it's an invasive thing that is completely unnecessary and is somehow wrong to do. Admittedly, if you are not sexually active and you've never been sexually active, your risk of getting cervical cancer is low because you've not been exposed to the virus. That doesn't mean to say it's completely zero. That's not the case at all. You can have sporadic reasons for, or spontaneous reasons for cervical cancer developing. It could be genetic issues, etc. As to why it might occur, but your risk directly related to the HPV virus is
Mhm.
distant in that regard.
Oh, okay.
So the reason that these groups of women tend to not want to present is because it's seen as something that is very private, and they don't feel empowered, or it's not appropriate, or quite frankly they're uneducated as to their reproductive system. So they don't have a clue. They don't know what their reproductive system looks like. They don't know how it works.
Mhm.
They just exist and know it's there, and know that they can carry babies and use it for other things, and that's it. That's where their knowledge stops. And it's not just the diaspora that has an issue with this. Even in this country, a lot of women, even with the accessibility of information, etc., are very, very unaware of the typical female anatomy. So I don't have a picture in my slides. I didn't think to put a picture, but basically we have three orifices as women. We have a hole that we wee out of. We have the vaginal opening where babies come from and you bleed, and then you have your bottom where you poo from. So there's three. Men have two. They have a place where they poo from, their bottom, and they have a urethral opening. And this is where they will urinate from and they will ejaculate from. So urine and sperm come from the same hole in men, whereas women have a separate hole for urine and a separate hole for giving birth for obvious reasons.
Oh, so how can we? I mean, based on what you just said,
Hmm.
how can we educate, our young girls to own their bodies, to fully understand, their bodies very, 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 very well? Because if a lot of people, just feel that they are, their bodies are just meant for just giving birth, and it just
Mm.
ends there. What can we do? And especially you being a doctor, what are some of the things that you can do to make sure women, um, especially from the African and also from the Asian backgrounds, fully understand,
Hmm.
their bodies? What can you do?
Mm. So I think it's reframing the narrative when it comes to reproductive organs. So the same way I talk about my eyes and my nose and my mouth, we
Mm-hmm.
should be able to talk about our reproductive systems. And obviously, there is a time and a place that we should talk about things, and people should always feel comfortable about talking about things. But what they shouldn't feel about any part of their body is shame. That should never be an option. You should be able to feel that you are empowered to discuss different problems that you have in any part of your body with relevant and appropriate people. So in what I'm trying to say is that if you have a problem, no matter which part of your body is, you should feel confident and empowered to speak to your doctor or your nurse or your health provider, pharmacist, whoever that is, about getting advice. It shouldn't be seen as something that is dirty, or if you do have more information than somewhere else, you're seen as being loose, shall we say, like as
Yeah.
having too much knowledge and being something that's undesirable because you must have gone around and done things. No, it's important. The same way we know what food is good for us and what
Yeah.
food is bad for us, the same way we should know what is bad that's happening within our bodies and what is good that's happening within our bodies. So, for example, so this is slightly off topic, but if we look at things like a female genital mutilation, a lot of women either don't know they've had it and don't understand that it's not a common practice, or if they have had it, are unaware that there is serious problems with their genitals and they consider it normal because they've never been told any different. So I've heard of cases of women having cysts the size of an orange, a small orange, on their genitals, and they think this is normal. They think it's normal to spend half an hour trying to urinate. They think it's normal to bleed for weeks on end because the hole that they're bleeding out of is so small that the blood and the clots cannot pass appropriately. They think it's normal to have recurrent urinary tract infections. And the reason they think it's normal is because we've made it abnormal to talk about our bodies as if they are something that is foreign to us.
Mhm.
Our bodies are not foreign to us. We can't place our genitals in a cupboard and then pick them up when we feel like it. We come as a whole. And it's about understanding that we come as a whole and having safe spaces that you can talk about things. Your doctors will always be a safe space for you to talk to. If you always want a female doctor, you can ask for that. Even if you have a male doctor, they will treat you exactly the same, but preference is there. I personally would want to be seen by a female doctor. That's my own preference. But if you were seen by a male doctor, that's absolutely fine as well, especially if they're the only ones available. Essentially, the main thing that I'm trying to get across here is that you should see every part of your body as being worthy of your time and understanding. No part of your body should be neglected because shame is in front of you or because other people tell you that you shouldn't talk about it.
Great. I'm so glad you've said that, because many of us, especially those of us who grew up in Africa, we were brought up, thinking that it's not right, or it's not even worthy to, talk
Mm,
about your genitals or anything like that. So I'm so glad that
mhm,
tonight you've actually, emphatically, placed so much importance on this,
mm,
and I cannot, say much on this one. So, let's go back to the cervical screening.
mhm,
Um, More people want to know, like especially those who have not actually done it before. They just want
mm.
to know, what are the do's and don'ts, before they have the screening test, and also what happens, at the appointment today. What happens on the D day that
Okay,
they're supposed to be going for their
good.
test.
So I'm glad you asked that. So um, I have this booklet. I don't know if you can see
Okay,
it.
sure.
So have a smearing test. Having a
Mm-hmm.
smearing test, a smear test. Sorry. What is it about? And it's by this charity called Joe's Cervical Cancer Trust. I don't know if I can
Okay.
get it in shot. It's very difficult doing things mirror image. But yeah, it's
Yeah, we
there.
can see it. Yeah.
Um, yeah, so basically this booklet goes step by step what to expect and how to prepare.
Mm-hmm.
So essentially, when you're preparing for your cervical smear test, sorry, there's a few things that you need to consider. So you shouldn't be bleeding at that time. So if you're on your period, you should pick a day that you're not. The reason being is that it will obscure the cells. With all the red cells that are there, the cervical cells will be very difficult to distinguish. And it's not possible for us to wash the red cells away and leave the cervical cells behind. We just don't have those kind of techniques in place. So do it on a day that you're not bleeding. Another thing is no intercourse about 2 days beforehand, because again, that can obscure the results. If you've got lots of sperm cells there, that can interfere with the interpretation of the results. So those are the two main things. Also, if you have any questions or anything like that with regards to what kind of clothing, etc., to wear, or what the setup is in terms of the office, always call ahead and ask if you have any questions. Generally, in terms of the appropriate clothing to wear, you can wear anything you like. You will need to remove it anyway. The easiest thing to do is to wear something that's easy for you to take off. So, not fitted trousers that are extremely difficult to put on and off. You want to feel comfortable. Maybe some leggings and a dress, or some easy to put on and off trousers, and some normal sized underwear. I would advise against wearing thongs. Generally, I would advise against wearing thongs, just because they cause irritation and are more likely to give you infections um, for other reasons, which we will discuss because of how tight they are and how much contact they have with the vagina and the anus. You're more likely to get yeast infections and UTIs. But for this purpose specifically, wear normal sized underwear, so full briefs, or bikini briefs, anything like that, because essentially afterwards, I would advise if you take a pad along, or at least a panty liner, because you might have a few drops of blood afterwards, and that's just because of the act of scraping away some of the cells. I say the word scraping, but there's no blades involved. I just want to make that very clear. If Nana, is it possible for you to share your screen and show the first picture that I sent you?
Okay.
It's of the equipment.
Okay, the equipment. Okay.
Mm-hmm.
1 minute.
No problem.
Okay.
Perfect. Okay. So this is the equipment that's used at the cervical screening or the smear test. The equipment furthest on the left is called a speculum. It's a plastic device that's inserted into the vagina slowly. It's rotated and then opened, as shown in the second picture. When it's opened like that, the third item, which is the small brush, is used, and it's twisted clockwise a couple of times, maybe 5, 6 times, up to 10 times, to be able to get some of the cells off very gently. You won't feel it. Or if you do feel it, it's ever so slightly uncomfortable, but again, should not be painful. That is then removed and placed into a jar, and that jar has some fluid in it. That fluid is then used to wash off the cells that have been taken off the cervix. That pot is then sealed and sent away and tested for the HPV virus, so the human papilloma virus, and is also then, if the human papilloma virus is present, the cells are then looked at and seen if there's any abnormalities present. So that's the typical way that a visit would be done. You go there, you will see your nurse will explain exactly how to sit. And that's usually on your back with your knees up towards your chest, and then you'll let your feet together, and then your legs flop open. So essentially, imagine this is your knees, and then your legs flop open,
Mm-hmm.
and that will open up the vaginal canal. So, Nana, if possible, could you show me the third picture, please?
Is it the one with the
The drapes and the cervix you can see. So like the green bits. No,
no,
so 2 before that, I think. That one,
yeah,
yes, this one.
yeah.
Yeah, perfect. So this is what we can see when we use this device. So this picture is just for illustration. The device that they're using is slightly, it's a different speculum. It's not the same speculum. The opening, basically, it's not as wide as this, it's a bit more narrow, and the cervix isn't as far forward. It's just, this is just an illustrative picture, but
Okay.
essentially we have to get quite close to your vaginal opening, and we can see inside. So we will crouch down ever so slightly, and we can see inside, and this is essentially what we're looking at. And this is your cervix. So this is the tip or the bottom of your womb where the baby would eventually come out if you were giving birth, or any blood that would come out from your womb would leave from. And what we're looking for is any abnormality that's there, that's obvious to look at. So if we look at it and we know it's an abnormality, we will say so. If we don't see anything, we will just take the cells off by twisting the brush, and then we will remove. Once we've removed, that whole area is closed. Thank you, Nana. That picture can go
Great.
now.
Yeah. So, um, for those who complain of about pain, what are some of the
Mhm.
things that people can try to make that the test a bit bearable for them
So
the day?
it wouldn't, yeah, so it wouldn't be a bad idea to take some paracetamol just before your appointment. So about 30 minutes before your appointment, taking some paracetamol, maybe some ibuprofen if you can. Generally, most people can take paracetamol. Some people can't take ibuprofen. So people who've had problems with their stomach, bleeding, any ulcers, stuff like that, they shouldn't take ibuprofen, just take paracetamol.
Okay.
But if you can take ibuprofen or paracetamol or both, if you're able to, and that will help give you some pain relief for after the procedure. Other things are that you can ask to see the speculum beforehand. And when I've done this before, I usually give the speculum to the women that I'm going to do the procedure on and show it to them so that they can see exactly how big it is. That's another point as well. We have different sizes of speculum. It's not one size fits all. We have small, medium, large, and large, long as well. So we have different lengths. If you've given birth, you will need a larger one. If you haven't given birth, you'll need a smaller one, as a general rule. If you're a larger person, you'll probably need a larger one. So ways to be comfortable is take some paracetamol, ask to see the speculum beforehand, ask the person who's doing the procedure to talk you through the procedure using the equipment first on their own hand. So say they can show this is your cervix and this is the speculum. They will show you it going in, show you it opening, and show you it closing so that you have a full picture of exactly what's happening, because you won't see this as it's being done because it's in a place that you can't see. The other thing is to remind them that you would like them to stop if you're uncomfortable. They should already give you this information and they should stop if you're uncomfortable, but just remind them and say, look, if I'm uncomfortable, I would like you to stop, or I'd like you to go very, very slowly. And I will tell you if I'm uncomfortable at any point. If I am uncomfortable, I would like you to stop. I do not want you to remove it, but I would like you to stop. What I tend to tell my patients is that if they're uncomfortable, they tell me immediately, or if there's any pain, they tell me immediately, and I stop. What I don't do is pull it out, because that can cause pain. You stop where you are, and then you slowly close the speculum. And that's the way to relieve some of the pain. Sometimes even opening the speculum, if it's got caught on the sides of the vaginal wall as well, that can happen. So generally, just being prepared when you go in there, asking questions, feeling confident, and having a active dialogue with the person that's doing the procedure for you, and taking some paracetamol beforehand.
Great. And let's go back a bit
Mm-hmm.
concerning what people shouldn't do before they have the smear test done.
Mm-hmm.
I think you mentioned two, and I just want to ask, can people also use sex toys and also lubricants and also to,
So I would advise against lubricants. Um,
what about condoms
because
and stuff like that?
so no sex
Okay.
generally for at least 2 days beforehand, none at all.
Mm.
And I would probably put sex toys in there as well, um, just because if you're using any kind of lubricant with that, it can obscure the cells and nullify the results. So part of the results, you can get results that are normal, you can get results that are inadequate, you can get results with slightly abnormal cells, and you can get results with more abnormal or very abnormal, or this is definitely cancer level of results. So there's various criteria that you can get. I'm just trying to see if amongst my notes I have that on here. Yeah. So there's different. So it's called dyskaryosis is the name that we give for the cells that are abnormal. And as I was saying, we have something called borderline, which is a word that we use. The mild dyskaryosis, moderate or severe, or invasive neoplasia. So these are the terms that we use when we're talking about and describing the cells and how they look, and seeing if there is an abnormality and any further investigations that need to be done.
Great.
I
So,
think, did that answer your
um,
question?
yeah. So, at what age is cervical cancer not recommended? At what age?
So the smearing test is
Mm.
done between the ages of 25 and 64. So at 25 is when you'll be invited for your first cervical screening test. Usually within 6 months of you becoming 25 or before you're 25. So even when you're 24 and 6 months, you could be called for a cervical screening test. You'll be asked to come every 3 years up until I think you're about 40 years old. Let me just confirm that. So 50 years old, my apologies. So up
Okay.
until you're 50 years old, and then after 50, every 5 years. So essentially, you'd only have two more, sorry, three more. And then after 65, you would only have repeated tests if you had abnormal tests beforehand, or you didn't come to the screening when you were greater than 50 years old. And the intervals between those tests will depend on how abnormal those results were and your family history, risk of cancer, etc. So they might sometimes, if there's abnormal results, call you every 12 months. Sometimes they might give it a few years, etc., if there's no abnormal results, but it's been a while since you first presented for a cervical screening. So it all depends on your history and what the cells show as to the intervals. But as a general rule, 25 to 50 every 3 years, beyond 50 every 5 years. So that will be a total of 3 more after 50. And then after 65, you won't have any more screening unless you had abnormal results before, or unless you didn't come to your screening before when you were in your 50s.
Great. I know we are not talking about cervical cancer tonight, but like it looks like it's claiming a lot of life. So I just want to know, between the first time or your appointments, like in between your appointments, what can what are some of the things that women should actually look out for these symptoms of this cancer that's actually claiming a lot of lives now, especially people of color?
Mm,
Yeah.
yes. So the the thing with the female reproductive system is that when there is a problem, it's the same set of symptoms that tend to present. It's incumbent upon us, so it's important that we as women actively present and say something's not right, and then it's up to the clinician to then do the right tests, ask the right questions, and then be able to decide if there is something wrong or if there's nothing wrong. So typically with cervical cancer, you might have abnormal bleeding. And, what do I mean by abnormal bleeding? Abnormal bleeding is any bleeding that is not secular. So that is not related to your cycle. So essentially, that's bleeding in between your cycle, or bleeding after intercourse, or bleeding beyond your cycle, so continual bleeding, or random spotting that has no rhyme or reason and that just appears and disappears. Sorry. So that's one sign. Another one is bloating. So sometimes women will say that they feel bloated, and they're not really sure why. Again, that can be due to hormones, but that can also be a sign of cancer. So if they're bloated a lot, so if their tummy is particularly big and full looking, sometimes that's a sign of cervical cancer. It could also be a sign of ovarian cancer, uterine cancer, multiple types. It could be other issues as well, unrelated to the reproductive system. So that's another sign. Any pain that's very non-specific and you don't know where it's coming from, and it's not related to you going for a poo or being constipated or having diarrhea or any infection, anything like that, that's another sign and symptom to look out for. Irregular periods as well could be another sign. So if you've got bleeding that doesn't seem to have any rhyme and reason. So the important thing to also note is that the bleeding during your period and when you're bleeding as a result of an abnormality in your cervix is not always distinguished. You cannot always say, oh, this is the period and this is bleeding from an abnormal cervix. The bleeding might be so heavy that you can't tell the two apart. So that's why I say irregular periods is that to you, who hasn't checked hormone levels and done all the parameters, it's going to look like another period. When in actual fact, that could be a sign or symptom of an abnormal cells that are causing excessive bleeding from the cervix. So in order to determine between the two, you need to go and have further tests. So irregular bleeding, bleeding between periods, bleeding after sex, abnormal spotting of any sort, a brown, red, whatever, any bloating, any pain, these are all signs and symptoms for you to get checked.
Great. So in cases where people bleed or get cramps after the smear test,
Mhm.
heavy bleeding, what does that mean? When people have the smear test and then, they just go on to bleed heavily. What does that mean?
So, so that can happen, and sometimes that can be due to a benign outgrowth of the uterine lining, something called an ectropion. An ectropion is, for all intents and purposes, benign. if it's diagnosed as that, but it's something that has to be diagnosed by an experienced clinician. And it's something that can be treated by burning off the lining. It's more irritating than anything. It's not something that will cause problems. It's not cancerous per se. It's just an outgrowth. So some of these women who have this will have bleeding for a lot longer. So typically, if a woman does bleed a little bit after the screening, it will be for a couple of hours, maybe up to 6 hours, something like this. It depends on how long it takes for that blood to come out. So it will be perceived as bleeding, as in it's leaving the body, but the bleeding in terms of from the cervix has stopped. So if you imagine your cervix is up here, the vaginal canal is down here, that blood needs to get from here down to here. So even if the bleeding has stopped here, it still needs to leave your body. So the bleeding might have stopped within an hour or less, but it will take hours for it to come down and leave your body. So it doesn't mean you're continually bleeding. It just means that blood hasn't finished leaving your body. So it's technically bleeding as in it's coming from your body, but the source of the bleeding has stopped, if that makes sense.
Yeah, yeah, it is.
Yeah, so the
And
cramping is a normal side effect of having something inserted.
because I've got women with endometriosis and also menopause also complaining of painful cervical, screening. I mean, why such
Yeah,
women
so
experience pain?
yeah, so so endometriosis is a pathological condition, and this is related to parts of the endometrium, so the lining of the uterus that grow outside of the uterus or in other places on the uterus, and essentially do everything that your normal uterine lining would do. So they are affected by all the hormonal changes. So you've got the beginning of your cycle. When you start bleeding, you bleed for 4 to 6 to 7 days, whichever, however length of your cycle is. In between there, you'll have cramping, the bleeding might be heavy, it might get light, it might get heavy again. So you can imagine you've got your uterus doing that, and all these random patches of essentially bits of the inside of your uterus planted all over your stomach. And they're all doing the same thing at the same time. So it's not just your uterus that's bleeding, those patches are bleeding too. So if that happens, the pain can be very, very intense. And unfortunately, it can take years to get a positive diagnosis of endometriosis, just because of women either presenting with very non-specific symptoms, or if I'm honest, them not being listened to in a way that is productive and useful, and them having the right tests at the right time in order to get the correct diagnosis. And this is something, as a medical profession, we need to work on in terms of listening to women and meeting their needs and not being dismissive of the pain that women have. Historically, in medicine, there has been a culture of being dismissive towards women's pain,
Yeah,
especially when it relates to reproductive pain. And I can say that as a doctor and as a clinician, that that does happen, unfortunately. It's something that is improving now, but there are countless studies. It won't take very long for you to find studies out there saying that women will get pain relief a lot later than men, them not being believed, etc. Which is why it's important that you advocate for yourself. If something is not right, get a second opinion, get a third opinion, get a fourth opinion, change your doctor if you need to. There's nothing wrong with getting a second opinion. In fact, we should encourage it as doctors. We should not assume that we know everything and that our diagnoses are 100% right 100% of the time. It's not the case. We're only human, and we can only work with what we have. If you don't do the tests, you're not going to know. You need to do the tests in order to know if the results are yes or no in terms of making the correct diagnosis. So these women who have some of these issues, it's related to the fact that they have chronic conditions that are ongoing. With regards to menopausal women, the reason that they may have pain is because after the menopause, the vaginal canal does what we call atrophies. It shrinks, it gets smaller. And that's because the levels of estrogen go from being here to being right down here, postmenopausal. So women who are in the menopause, they might take HRT, which is there's a hot debate about it, whether or not it's appropriate, whether or not it increases your risk of other problems, etc. Or they might have topical treatments like an estrogen cream that you can put into the vaginal canal, or rather outside and in a little bit, and it can lubricate things and make things less uncomfortable. It's usually those women that we would use a smaller speculum for and insert and see, because those women, the vaginal canal is a lot smaller and they may not be sexually active, the whole procedure is likely to be more uncomfortable for them. But again, it shouldn't be painful. If you use the correct size speculum and you go slowly and you explain every single step as you're doing it, it should not be a painful experience. I've had women personally who have been terrified of having a speculum. But because I need to get more information as to what's going on with them and what's happening, I've been able to perform a speculum on them, even when they've been scared, they've been shaking, etc., just by talking to them and just by allowing them to take the lead themselves, letting them hold the speculum, letting them do everything that they need to do, understand it, and me talking every single step. For example, I would say, I'm now inserting the speculum. I'm now going to twist the speculum. I'm now going to insert it further. And then each time getting confirmation that they're happy for me to do that, saying, I'm now going to open it and I'm going to open it very, very slowly. Tell me to stop at any point and I will stop. And then we go through the whole procedure like that. And to this day, I've never had a woman who has had pain and has asked me to stop and remove. I've not to this day. That's not to say that there's some women out there that is completely intolerable for. There are women like this. And that's a whole nother issue. There's something called vaginismus, and that's a spontaneous contracting of the vaginal canal, which makes it impossible to insert anything. That's a whole different conversation. There's whole topics and web pages on those issues, and that's different. But if you don't have any of those issues, talking very, very carefully and going slowly with your health practitioner will more than likely alleviate any concerns you have and relax you enough so that you can have the procedure done.
Wonderful, because okay, tonight we can end, the discussion on cervical screening without not actually mentioning our trans men. So should trans men and also non-binary people, also with cervix, be invited for cervical screening?
Absolutely. Absolutely. So if someone who is born female and they decide that they want to change genders, if they have a cervix, they need to have cervical screening. Even if there's someone who has never had male sexual contact, they need to have cervical screening. The reason being is that most men carry the HPV virus, but it can be passed from person to person via sexual contact. And that's the key thing. Remember what I said in the beginning? Any kind of sexual contact, you can pass on the HPV virus. Even if if you have your uterus removed and your cervix removed, then of course you don't need a cervical screening test. There's no cervix there anymore. But if you do have a cervix, so far as you have a cervix, you need to have the screening. What you feel in terms of your gender, etc., is very different to what the body that you have in front of us. And as clinicians, yes, the two go hand in hand, but we have to remember that this is female anatomy. Regardless of the gender of that person, I'm dealing with female anatomy. That's my concern. My concern is that you have a cervix, it needs to be screened. That's it.
Great. Yeah, you had some, pictures that you wanted, just wanted us to
Yes.
just go through. So if you can just tell us which one to upload and.
So let's upload the last one, because that gives a nice, so the one with the different
Is it this one?
cervixes and uteruses. Yes, this one, perfect.
Okay.
So this one is a view of the cervix. So so the top picture, and four of the top pictures, so different ones, but with slight differences, is as if a woman is standing in front of you, and we were to just open up her abdomen and see her tummy and see her uterus. This is the view we would be looking at if we were to just slice in front and see. This picture, the first one, is a normal uterus and a normal cervix. And the picture below it is the picture that I showed you before about what we can see as practitioners. So as nurses, as doctors, as whoever, physicians, associates, whoever is looking at that cervix, they can see the bottom picture. If we were to cut someone open and look inside, they would see the top picture. If you were to slice the uterus down the top, going down and fold it over, this is what you would see. The first one is normal. The second one is early stage of cancer. So this is what I was saying about us looking. We don't just take the cells, we look. The third one is a further stage of cancer that has spread further up. The fourth picture is cancer that has gone beyond the cervix and is in the surrounding tissues around that. That one would need a radical hysterectomy and lots of other things. So a hysterectomy is the complete removal of the womb. This is a cancer that has spread to other areas and it's no longer viable to keep that reproductive organ in place. The second picture, where there's earlier stages of cancer, that can potentially be removed with a surgical procedure to remove that part as part of something called a colposcopy, which is a camera that's inserted so that you can accurately see what you're doing and remove that. That might be enough to cure the cancer. The second one might need the same procedure or maybe something more invasive, like a surgical procedure to remove part of the cervix. If that is the case, it will compromise the woman's ability to carry a baby because the cervix needs to remain closed in order for that baby to grow and basically not miscarry and fall out. So if a woman does have to have some of these procedures, they may need to have further checkups or closer monitoring if they do become pregnant because their cervix won't work as well as it used to if it's quite an extensive procedure. So there is one more picture I think would be a good idea to show. So that's the 1, 2, 3, 4. The fourth picture, Nana. So before you show this fourth picture, Nana, this is quite an explicit picture. It's an actual picture of a cervix. So if anyone is uncomfortable seeing a normal cervix as it looks now, then I would suggest maybe turning the
No.
video off briefly.
No, fine.
Yeah, everyone is fine. Okay, perfect.
Yeah, because we're having. Is it this one? No.
Yes, perfect.
Okay.
This is the one. Yeah, this is it. So as you can see, this is the cervix, how it looks. This here is not cancer. This is thrush. So it's very normal for women to have discharge, and discharge is there all the time, 24/7. It never goes away. The amount will vary. When you get past menopause, the amount of discharge diminishes dramatically because you don't have the hormones and the hormonal feedback from the brain telling more of the discharge to be produced, which is why you have the drying of the vagina and the shrinking of the vagina, etc. Thrush occurs if you have issues with the bacterial balance within the vagina. And this thrush can sit on the cervix like this and can cause irritation. It can cause discharge, as you can see out here. So this is mixed with normal discharge. So the normal discharge is more in the middle. This cottage cheese kind of thick discharge, that's yeast, essentially. So we call it candida. Candida is just a fancy name, like a Latin name for a yeast infection. A lay name for a yeast infection is a thrush infection. And essentially, that's what we see if we look in someone's cervix. That will come out of your body and you will see it on your underwear. So if you see discharge on your underwear that's very thick and clumpy, that is most likely thrush. It can be treated with a pessary. So that's a tablet size, so size of a bullet roughly, and you insert that into the vagina. That's it, treatment done. If you can't insert a pessary, then you take a tablet, treatment done.
Excuse me.
If women are pregnant, they tend to avoid giving women oral medication. They may advise either no treatment if they think it's likely to clear up itself. If they're worried it won't clear up, then they might give them a pessary because it's locally active. It depends on each woman and what their doctor is trying to achieve or trying to avoid, etc. If someone has a very threatened pregnancy and they're worried about inducing labor or anything like that, they may not insert anything into the vagina. They may just use a topical cream. So that's a cream that you put on the outside of the vagina, and that usually can clear up very mild cases of thrush.
Excuse me. Wow. So, talking about pregnancy, Does it mean that if someone is pregnant, that
Mhm.
person can have a smear test done? I mean, if you can clarify
No,
that.
no,
Okay,
they
that's
can't.
fine.
No,
That's fine.
because essentially you could stimulate the cervix.
Okay.
They will
Okay.
have to wait. Similarly with the colposcopy as well, so that procedure with the camera, they
Mm-hmm.
will have to wait. Having said that, though, when you're pregnant, you can still have a speculum. So the instrument that we use to insert and look at the cervix,
Mm-hmm.
you can 100% have that done. And we routinely do that to look at women's cervixes and see if there's any problems, if the woman comes in bleeding, in pain, if they have any kind of problems at all, we will typically look at the cervix with the speculum. That is perfectly safe to do. Brushing, bless you, Nana. Brushing with the brush is not advised because you can stimulate the cervix to do and cause it to open, and we don't do that.
We have, I think, two more pictures. Okay, before we go to the yeast infection, I don't know if there's any.
Yeah, those pictures are related to yeast infection. So
Okay, yeah, that's fine. That's fine. So, I mean, if you can just talk to us about, what yeast infection is all about and why, women, some women do have it, over and over again. Yeah.
yeah, so basically, as I was saying earlier, yeast infection is a buildup of the Candida albicans yeast, essentially. And this is something that can be present in the vaginal canal. It can also be present in the mouth, especially of newborns. That's very common for babies to get a yeast infection on their tongue. Some people can get yeast infections in their mouth if they're immunocompromised. So if they have HIV or if they're on chemotherapy, those are all reasons that they might end up with a yeast infection in the mouth or in the vaginal canal. If people have diabetes, they're more likely to get recurrent yeast infections, especially if their blood sugar is poorly controlled. Because essentially, if you have uncontrolled diabetes, you're weeing out sugar. Your sugar, so your urine is full of sugar. If you do that, you will have recurrent urinary tract infections and you will have recurrent yeast infections. You will also have a lot of other problems. But you need to, very, very, very important, if you have diabetes, you need to get it under control, whatever that control looks like, whether that's diet, whether that's tablets, whether that's insulin, whatever it is you need to do, whether that's weight loss, whatever it is that you need to do, you need to get it under control, because you'd be surprised the amount of symptoms that people have related to their diabetes. Diabetes is one thing, and it can lead on to a multitude of other things. That's why we talk about diabetes so much. Not because having high sugar is not good and there's no real reason, it's because it can cause so many problems. So, going back a little bit, yeast infections, typically when people get them recurrently, it's because of things like diabetes, immunocompromisation, so having a reduced immune system. That could be because of medication that you're on, chemotherapy, or because someone has something like HIV as well. And other reasons could be douching. So douching is where people flush their vaginal canal with water. So they might put a syringe or some sort of other device and flush water into the vaginal canal. 100% don't do it. You don't need to do it. You never need to do it. The vaginal canal is a self-cleaning organ. It cleans itself. Anything that's in there will come back out. I guarantee you. Unless you have a problem in there, your body will remove it normally. So that's what the discharge is there for. It helps to remove anything that was in there that shouldn't be in there, and helps to maintain the normal flora, so the normal bacteria within the vagina. So douching as well, wearing tight underwear. So this goes back to what I was saying at the beginning of our talk about thongs and why I don't like them. I don't like them because they're very, very fitted, and invariably they're not made out of cotton, and they don't allow the vagina to breathe very well and create a breeding ground for infection. So women who constantly wear thong underwear, the poo area and the vaginal canal are very close together in women. When you wear thongs and they rub and they're so close together, you're introducing poo into the vaginal area. Then you get a
Wow.
UTI. Yes, of course. Because if you think about it, when you pull it up, it's all tight, it's all pressed up on there. It's not like normal knickers when you wear them, it's not touching your anus, the opening of your bottom, it's just sitting there. If the thong is very tight on there and you take it off to go to the toilet, then you put it back on, it might reposition itself. And because it's so close to the anal canal, and because there's the tiniest gap, something called the perineum, between the bottom and the vagina, very, very tiny gap, barely 2 centimeters, that can then move. Of course, your underwear can move 2 centimeters, especially if it's really close. So all of that that's back there is now in the front. So that's why I just don't like them. You can wear them for a little bit if you want to dress up for whatever reason, but I definitely wouldn't recommend wearing them day in, day out. As a general rule, I would advise wearing cotton underwear only. Obviously, when you're on your period, etc., you need to wear pads, etc. Just remember to replace them on time, change them, etc. Another way people can get thrush infections is using tampons. So tampons can cause yeast infections if they're not used correctly, and even if they are used correctly. If your fingers are dirty before you insert one, you're introducing bacteria or yeast into the vaginal canal. So your hands have lots of things on them. They can have bacteria, they can have fungus, they can have viruses, all kinds of things can be on our hands. That's why it's so important we wash them. So if your hands are dirty and then you insert a tampon inside, you're basically introducing whatever's on your hands into your vagina. And that will cause an infection of some sort, and potentially a urinary tract infection if you're just touching that area with dirty hands, or can cause thrush if you insert with a dirty hand. Also, leaving tampons in for too long increases your risk of infection generally, and something called toxic shock syndrome, which can be a fatal condition. So that's basically sepsis that covers the whole body and can kill someone if it's left in for too long. But going back to this talk, thrush can be caused by multiple different things. And generally, as a rule of thumb, wear cotton underwear, don't put anything into the vaginal canal, wash with water only, don't use any soaps, definitely don't use Femfresh or anything, any of those brands, or Vagisil. They're terrible, they're absolutely awful brands. Don't use any of those things. Using just water is what we would recommend as clinicians. If you're on your period, you can use a very light cleanser. So aqueous cream is something that we would normally use to cream our body, but you can use it as a cleanser. So using a bit of aqueous cream is very gentle on the skin and is pH neutral, as we call it. So won't cause acidity or won't change the balance in your vaginal canal. And you can use that to wash if there is an issue. You can use some very gentle cleansers as well that are unperfumed, that if you prefer as well, but try not to use soap-based ones because they dry out that area and can cause other problems as well. But definitely don't use anything perfumed. And if you can help it, only use water to clean your genitals at all as women.
Oh, talking about douching, we have it, like in our community where we say, women should use stuff, just to tighten up the place, just to make the place a bit, sweeter. That's the term out there.
Mm.
And like you're telling us tonight that it's not important to be putting in stuff there, just to cleanse the place and also to tighten up the place. Um, um,
Radical
I'm
thinking,
confused.
right?
I don't know because
But this is the thing. So this is why it's important to have open dialogue. So it's very easy for me as a clinician to say, okay, this is what I think you should do, and this is why I think you should do it. But then if you turn around and say, well, this is important to me that my vaginal opening is really tight because I prefer it that way, or, I like it to look a certain way or smell a certain way. I need to listen to those reasons and then ask you why. Why is that important to you? And then explain to you, okay, fine, if this is what you want, maybe this is a middle ground. This is what you can do. So, as I was saying before, ideally water. If you're like, no, I need more than that, then a gentle cleanser, something without perfume. I would never recommend something with perfume, of course, but it's a middle ground rather than you're saying absolutely not to water. The same way when it comes to inserting things in there, that's always going to be a no for me. But if you say that you want to make sure that things are tighter there, then what I would say is that doing pelvic floor exercises will help. Pelvic floor can be reduced if you have multiple pregnancies, or if you have a complication in your pregnancy or in your delivery that compromises your pelvic floor. So your pelvic floor is what allows you to remain continent and stops you um, wetting yourself or urinating on yourself if without any control. So bladder issues generally. So if you say to me, I want to make sure everything is really tight, then I would say do bladder exercises. So the best way to know where your pelvic floor is next time you go to the toilet, stop going. So you urinate, then stop. Then you carry on, then stop. That way you've identified your pelvic floor. That's it. Some people say you can feel it and you can tighten it, and they say, oh, I'm tightening it now, and now I'm stopping. Now I'm tightening. Some women don't know. They're like, I'm tightening something, I don't know what that is. If you wee and then you stop weeing, that's your pelvic floor because you stopped weeing. If you start weeing again, that's your pelvic floor. The more you do that, the better control you will have of your pelvic floor, and that will increase your ability to remain continent after giving birth. So again, it's dialogue. It's me understanding what your needs are, seeing if there's a middle ground, and making sure that I listen to your opinions and accept them as valid concerns and valid issues that you have, and not just saying my way or no way.
Okay, so things like oral sex, so where people, I think just to enjoy themselves, sometimes they go over the top by even putting ice cream, yogurts there, just to, you know, just to make things, better in the bedroom. I don't know. I mean,
Um.
what do you
So
can say
okay.
to
So
that?
so again with that, everyone's entitled to have their fun. But I would say if you really, really want to lick ice cream off your partner, stick it in their belly button. Don't stick things in there. It's a compromise. You're still doing it, but
You're
I
gonna
would
come after
advise
me
against
tonight.
putting ice cream there. It's an alternative. So again, and I'm listening. So, instead of saying absolutely not, no way, I'm saying, look, ice cream is a bad idea in the vaginal canal, as is yogurt, unless it's natural yogurt. And, there's other reasons as to why you might or may not do that. But if you really, really want to lick ice cream out of your partner, just put it in their belly button instead. That's fine. I've got no problem with that.
This is from Dr. Zainab. That's not from me.
That'd be the advice
I
now.
mean, that's
Belly
crazy
button
things
ice
going
cream.
on, out there. So I need to cover all these questions, for people,
Absolutely
actually
fine.
who send them in. And so, how do we stop, the cycle of genital yeast infections, and, like especially the chronic ones? How do we stop, that cycle? Because I know you've mentioned a few, but I mean, how do we stop it entirely?
So, if the things that I've discussed haven't worked, so wearing loose underwear, not douching, being mindful of what you do and don't insert into the vaginal canal, then there are treatments that you can have more long term. So you can have tablets that you take once a week, or pessaries that you might have to use every week or so, or every day, depending on what regimen is considered best for you. So essentially, that's the same treatment. So there's something called clotrimazole and fluconazole. Those are antifungal medications, and they are taken either orally or via the pessary, where there's the thing that's shaped pretty much like a bullet, and you insert it into the vagina, and that takes care of everything. But what comes up must come down. So you'll end up with lots of chalk-like stuff in your underwear. So
Yeah.
if you're going to use pessaries, put a panty liner in or a pad or something like that, just to collect all of that. Otherwise, you'll just be very surprised when you see it all back in your underwear. But that's normal. That's exactly what it's meant to do. And that comes back again to what the vagina does, is that it doesn't like stuff in there, so it will remove it. It's in there, then it gets removed. So, with regards to chronic infections, it's about lifestyle changes. What are you doing that could be causing these recurrent yeast infections? And if we can't get on top of it, what can we do to help reduce the amount of times that you're getting those infections by giving you long-term treatment? And also seeing what the root cause is. So, if you've done all the lifestyle things, and if you're taking this medication chronically, we need to start thinking, does this person have HIV? Does this person have some sort of blood disorder that means that their immune system is compromised? Does this person have uncontrolled diabetes that is undiagnosed? So this person doesn't know they've had diabetes and have had it for years, and they've been peeing out sugar for absolutely ages. Their skin is terrible because the sugar is eating away at their skin, and they're getting recurrent thrush infections, recurrent UTIs as a result of having urine on their underwear, etc., that's covered in sugar. And is it that if I fix this diabetes, I put them on the right medication, I put them on a strict diet, I start them on insulin if needs be, and then all of a sudden the thrush is clear, and I've not treated the thrush, I've treated the reason that they keep getting the thrush. So it's multifactorial. You have to, as clinicians, be willing to investigate the different reasons and take what we call a very good history. So talk to your patients, understand your patients, understand what they're doing, understand the things that they aren't aware that might be happening, and be able to help your patients get to the correct diagnosis. So recurrent yeast infections are not always because someone is dirty. Invariably, they're not dirty. It could be because of something unrelated to the yeast infection, and it's up to us as clinicians to work that out.
So I think I'm so much about the diabetes, because I think most of the times a lot of women do not even know that they've got diabetes, and
Yeah.
they're just being treated for recurring yeast infection.
Mm.
Tonight, what do you say to such women? I mean, if things to look out for, just in case they keep on getting yeast infection.
So I think especially within the diaspora, so the African and Asian diaspora, I think it's extremely important that you should be screened for diabetes. And now we're at a point where it's not age specific. It's not older people getting type 2 diabetes. We've got 15-year-olds with type 2 diabetes now, unfortunately. So if you think you might have diabetes, you might have signs where you're thirsty, even though you're drinking loads and loads and loads, you're thirsty and you're weeing loads, and you're still thirsty and you're weeing loads, that's a sign of diabetes. If you're really, really tired and you don't know why, that might be a sign of diabetes. If you're very, very overweight, it might be that you have diabetes. Even if you're slim, some slim people have type 2 diabetes as well. If you have a family history of type 2 diabetes, I would encourage you to get checked, and that check will involve 1 or 2 blood tests. So your GP might do what we call a random blood sugar test. So that might be a prick on the finger, and that will tell you what your blood sugar is at any given moment in time. What they might also do is something called a HbA1c. HbA1c is a test that measures your blood sugar over 3 months. So there's no cheating. With this prick one, you cannot eat for 12 hours, maybe 15 hours, and then the blood sugar is low and you're like, I'm fine. But with this one, you can't cheat. If you've been able to control your diet for 3 months, you're not cheating, you fixed your diet. That's a good thing. So the HbA1c will definitively tell you if you're diabetic or not, or if you're pre-diabetic. So if the result is between being diabetic and not diabetic, and at that point we can make changes so that you're no longer diabetic, and that it removes the risk of having diabetes by changing your lifestyle. So that will usually be diet changes and maybe weight loss. Some people are a normal weight and they're pre-diabetic. So for them, it would be changing your diet, reducing the amount of sugar that you're eating, reducing the amount of carbohydrates. What people don't realize is that sugar is not Snickers, it's not Milo, it's not Asian sweets. That's not what sugar is. That's one part of sugar. Sugar is also white rice. It's also yam. It's also cassava. It's also, cornmeal. It's all of those things. Any starchy thing has sugar in
What
it.
about
It
plantain?
goes, mm,
What about plantain?
plantain as well. Plantain is a fruit. Will have sugar, even if it doesn't taste sweet. Rice is not sweet, right? But
Yeah.
it's what we call a complex carbohydrate that then gets broken down into a simpler carbohydrate. Sugar is a type of carbohydrate. You can have very complex carbohydrates that take time to be broken down, like bread, for example. So white bread is a complex carbohydrate, but is quickly broken down into a simple carbohydrate, which is a sugar, essentially. So it's broken down very quickly into sugar. Brown bread takes longer. So it's better to have than white bread. Same with brown rice. It's better to have than white rice because it takes longer to break that down, and it's got more fiber in it. So you feel fuller, you eat less of it, etc. So those are all different types of sugars that you can have. Don't get me wrong, though. I'm not saying that carbohydrates or starchy foods are bad. I'm not an advocate of good foods and bad foods. You can eat whatever you like in moderation. There should be no bad foods. Bad foods tend to create an unhealthy relationship with food. Even if you're a diabetic, you can still have treats. It doesn't mean you go your whole life without never picking up a sweet again. But you need to remember, if you're on insulin, you calculate your insulin dose. If you're going to be having that cake, not that you should never have the cake, change your insulin dose. So now you take more insulin because you've had that cake, less insulin because you've decided to have, a plate of vegetables instead, or a salad, something like that. Even if you're on metformin, for example, with tablets that we give first of all for people who are diabetic, you can still have cake, but you have it very rarely. You don't have it all the time. You can have it as a one-off, because the problem is that when you remove these things from people, they'll be like, forget this. I want to live my life. This is miserable. So you say to them, look, you can have this, but you can only have it twice a month. Pick your days. You can have your cake. That doesn't mean you have the whole cake, you have a slice, but you pick.
Great. I don't know if anyone out there has got any questions for Dr. Zainab, but I've been educated tonight and I've learned so much.
Great.
Yeah, so let's I don't know if you want us to talk about those two slides before.
Let's
I mean that's I
see.
mean it's entirely up to you. But if you think
So the vaginal thrush. So yeah, I suppose we can show the second slide, which just goes back to the speculum. I think I probably forgot to put it up, but it's a side view of what the speculum is like inside.
okay.
Yes, yeah, this is it. So when I was talking about the speculum being inserted, this is essentially what it is. It's inserted and then opened up inside. And then what you see, so the bit that's labeled the uterus, the tip that you can see there is the cervix. And that's what we're looking at. So this is a side view. So imagine someone lying on their back and you're looking at them. So they're on their side and you're looking at them as if you're looking at the side of their body and it's been cut in half. That's what you're looking at now. So that's the speculum as it's inserted and as it's looking at the cervix. That's all this picture is showing and how everything relates to it. The last picture is the vaginal thrush one. So yeah, so we can show this one. We can show the other parts of the body, how it relates as well. Yes. So as I was saying before, the top part of the picture is so the top part of the uterus, we call that the fundus, it's just the top. And then inside, that red bit that's in the middle, that's your endometrium and the uterus, essentially. So the bit that I was telling you about that might bleed. The two circular things on the outside are the ovaries, and they are connected by the fallopian tube. And then you've got various connective tissues that kind of keep everything together. So when we saw the other picture of the thrush, the one that I told you was a picture of a person's cervix with thrush, this is essentially where it relates to. So you've got the cervix there, which is the bottom part of the uterus or the opening of the uterus.
Yeah.
And then you have the vaginal canal, and that's where the thrush sits. The thrush does not sit inside the womb, it's outside the womb and in the vagina, which is why you can see it from the cervix onwards and downwards. So that's essentially what it is. And they've called it here Candida albicans, which is just Latin for thrush, like white thrush. It's descriptive.
So what happens to thrush? I mean, if it goes untreated for a long time, what happens to the person?
It just becomes unbearable for the most part. It's generally pretty benign as a condition, but it becomes unbearable. So maybe one thing I forgot to mention is that signs of thrush, some people might not get a discharge. It's not 100% of women that get this cottage cheese discharge that I was talking about. Some women might get itching, they might get soreness, and they might get swelling. And the swelling relates to the labia. So the labia is the outermost lips. So the fat part of the before the vagina. I don't know how to say the lips on the outside. So if a woman was to stand with her legs slightly open, those two kind of curved areas that you will see, those lips, those are the labia majora. That's just the medical name for it. So the outer lips and the inner lips. The outer lips often become very swollen, very painful, and very red. That's also a sign of a yeast infection. If that occurs and there's no bleeding and there's no other symptoms, then it's likely you have a yeast infection and they may just give you a pessary, etc., and say it's fine. If you have any bleeding associated with it, it's likely that it's probably not a yeast infection and it might be something more serious or just a different infection altogether. Important thing to remember is that although we've talked about thrush today, people can have similar symptoms and discharge, although it doesn't tend to be cottage cheese like, they can have other types of discharge, and that can be different types of infection. And this can be infections that are not STIs, so not sexually transmitted infections. These can be things like trichomonas or bacterial vaginosis. So these are things that can be caused by a imbalance of the normal bacteria within the vagina, and that can cause similar symptoms, but the discharge tends to look a bit different. So bacterial vaginosis, or BV as it's often called, has fishy odor discharge, and it's very thin. Trichomonas as well has very thin discharge, and sometimes it's quite bubbly because it's filled with all the bacteria and stuff. So it's very, very bubbly when it comes out as well. So those are other things that might look like thrush because of the extra discharge, but that could be something different. So just because you have discharge and other symptoms doesn't mean that it's definitely thrush. It could be other things as well. So that's an important thing to remember.
Okay, with the smell,
Mhm.
how do you tell, your from your normal smell, um, to the time that maybe like you notice a different smell from your normal smell?
So
But
your
especially if
normal
that
smell.
is shown, I mean,
So
just in case your normal smell is slightly, you know, different from what you smell. How do you know whether this is thrush or maybe the BV or the other things that you talked about? And
mhm.
also, can someone with thrush pass it on to the partner or maybe maybe to another person?
Mm. So
Mm.
potentially yes. So again, it goes back. If you've got yeast on your fingers, your hands are unclean, you insert fingers inside, you'll get thrush. If your partner has thrush and they have sex with you, they can give you thrush. It's not guaranteed, but you can get thrush. So you can pass it from person to person. It's possible because it's a yeast infection. If you have the right environment, it can happen. It doesn't mean it's definitely going to happen because our hands are never sterile and we touch all parts of our body, but we're not routinely getting infections as a result. Our bodies are very good at clearing away things that shouldn't be there. Our mouths, for example, lots of good stuff going on in there that stops us from getting mouth ulcers and all kinds of stuff. And our stomach obviously has a high pH, destroys all of that stuff. So essentially, when we're thinking about this infection, it's not something that always happens just because someone has had sexual contact.
Mm.
It can happen at any point, and it can be related to hormonal imbalances, and can be related to the things that I spoke about before. I don't know if that answers your question.
Yeah. I mean, I'm so particular about the smell because most of the times the reason why a lot of people, like a lot of women, tend to douche, by using all these, chemicals out there, is because they talk about the smell. Oh, I smell differently, or I smell a bit awful from my normal. So sometimes instead of seeking medical help, they buy all these, body wash or
Mm,
what should I say, vaginal wash, just to
mm,
bring the smell down. But tonight you've
mm,
made us aware that it doesn't even do anything. Like it's
no.
even worse than sex. So, like if anything at all, I think people are so particular about the smell. Like what is the
Mm.
normal smell, and what is the um,
So I think
If
us
you went like
accepting,
that.
yeah, so us accepting that we are human beings and we will have sense. We will smell of something. If you don't smell of anything, you're a plastic cup. That's what you are. You're going to have a scent. It's very normal. So what is normal and abnormal will vary in terms of where you are in your cycle and what is normal for you. As a general rule, if it's unpleasant for you, it's probably something wrong. If it's just like, oh, I just can smell my discharge a little bit more, it could be because of your hormones. So, depending where in your cycle you are, the discharge might be more or less. It might be thick, it might be thin. And depending on how much there is and if it's thick or not, will determine on how much you're able to smell. If it's thicker and there's more of it, you're more likely to smell it. If there's less of it and it's more watery, you're less likely to smell it, as a general rule. So, try not to focus on you smelling like roses or juniper or whatever. You're never going to smell like that. You're a human being, you're not a garden. So the key thing to remember is that smell is normal. It's normal to have a scent. What is important to distinguish is something that smells foul, and we generally as humans know what foul smells like, what bad smells like. We've been given a God-given sense of what doesn't smell right, and generally listen to that. If there's something not right, best thing to do is go to a doctor. Sometimes you can get over-the-counter tests. So I know now, I think you can get tests for thrush. You can buy them over the counter. So instead of you going to the GP, you can check for thrush yourself, and then you can buy the treatment if you need to. I know some people like to have that control to be able to do that, or they can't get a GP appointment, etc. So that is a possibility. But if you are concerned and the smell is not right, go to your GP. Or if you can't get hold of your GP for whatever reason and the symptoms are intolerable, call 111 or go to your urgent care, not A&E, urgent care. Because if it's intolerable, you can't sleep at night, it's itching, it's burning, it's sore. That's something that needs urgent treatment.
Yeah.
Yes, it's not going to affect your life, as in, like, it's not going to kill you, but it's intolerable. That's urgent. That's something that needs to be dealt with. So those are different avenues that you can go to. What I wouldn't recommend is self-medicating. The alternative to 111 and urgent care and your GP is your pharmacist. And this is something people overlook as well a lot, is that pharmacists can be a massive help in helping you get the right medication at the right time. Some pharmacists can even prescribe the medication for you. So there's certain medications that they can just write the prescription for you. Instead of you going to see your GP, you go and see certain pharmacists and they can do that for you. It's not widespread right now, but they're looking into making it more accessible as far as I'm aware. So going to your pharmacist, and they are a lot more accessible than the other options I've told you about. You can easily go into any pharmacy and you can speak to your pharmacist, tell them your symptoms and ask them what advice would they give you as to what treatment to start with. If that treatment doesn't work, then you can go back to your pharmacist, or you can try and go to your GP, get an appointment, get a review, get some extra tests done, and then take it from there. But definitely do not self-medicate. I would advise against it because you could be missing something more serious.
Yeah.
So remember, we were talking about cervical cancer, having screening, not necessarily knowing what the symptoms are, or having non-specific symptoms. Thrush might be an indicator of other things that are going on, and you shouldn't just assume. So like I said, someone having a HIV infection or diabetes, etc., rather than them self-medicating for months or even years with recurrent thrush, they should go to their GP, and their GP thinks outside of the box. Unless I told you now, you're not going to think of diabetes when you think of thrush, but it's up to us as clinicians to think like that.
Yeah. Before we end tonight's discussion, I think I've got a question here. That's a lady sent where she goes, when I was growing up as a child, my mom, used to tell me, to wash properly. You need to put your hands in there and, wash, because that's what African women, are taught, to do, just to make sure you smell nice and also you are clean for your either boyfriend or maybe for your husband, tonight. I just, you've spoken to us about a lot of things, but just
Hmm.
to clear this myth out there, wanting women to insect to wash properly.
Mm.
If you can just address this issue, because I think there's a lot of discussion and like a lot of whatever going on social media, women telling
Mm.
other like women to wash well by inserting their hands in there to to wash well. So you being a clinician, you
Mm.
know we just want you to debunk all these stuff that's actually going out there. And
Hmm.
two, how do people um, prevent this recurring yeast infection physically? Can they dispose of their clothes, those infected clothes, towels? I mean, how can they physically prevent this this yeast infection? Like in terms of their personal hygiene. I know, fine, you've spoken about so many things, but what can they do apart from the things that you've actually told us tonight in
Okay,
terms
so
of
let's answer the second question first. So, with regards to reducing the risk or recurrence of yeast
yeah.
infections, it comes back to how you are doing things in terms of lifestyle. So, what underwear are you wearing? What are you washing with? What products are you using? Are you inserting things that shouldn't be inserted in there? Are you keeping tampons in for too long? All of those things can increase your risk of yeast infections.
Oh, what about panty liners too? Because you mentioned tampons, so no.
Yeah, so liners are fine. Just try not to get scented ones. Get ones that say that they're breathable, because essentially some people will always wear something, so they either be wearing a liner or a pad. If you're going to be wearing liners every day and you're never going to have like just days where you're just wearing underwear, make sure that your liners are breathable. Make sure it says on there that it's a breathable liner, because if you wear something that is always covered with a plastic backing, your genitals will never get any air, and they're going to be prone to infection, prone
Infections.
to problems with the skin, etc. With regards to washing, in terms of the clothing, etc., you do not need to get rid of your clothing. Washing your clothes at 60 degrees should get rid of most things, including with the yeast infection, etc. Also, using, they have laundry cleansers now. I don't know, haven't done laboratory tests on them or anything like that, but they claim to get rid of 99.9% of bacteria at least. I think they probably cover some viruses in there, probably some fungus in there too. But I think using, a laundry cleanser that you can get for a couple of pounds from Tesco, wherever, and washing your underwear at a higher temperature. So you'll definitely need to wash it higher than 30 degrees if you want to make sure that you kill the yeast, etc. on there. But I think 60 should be fine. I don't think you need to wash clothes at 90 degrees. You'll have no clothes left if you do that. But yeah. But 60 degrees for a towel is definitely reasonable. I'd probably advise that if you've had recurrent yeast infections, wash all your towels, wash all your beddings at about 60 degrees. They're made from a type of cotton that is very tolerable in terms of being able to withstand those temperatures. Your underwear and your clothings maybe less so, because underwear has elastic in it. If you wash it at really high temperatures, the elastic will turn to rubbish and will snap before very long, and you'll be having to buy new underwear every month. But fitted sheets and towels, they usually do pretty good at high temperatures. So you can wash those regularly. But I think 40 degrees to 60 degrees with a good laundry cleanser as well should be able to get most of it. But we definitely wouldn't recommend you having to throw your underwear away. I don't think you need to do that. Sorry, remind me of the first question
No,
again.
no, no. The first question was like a lady that actually told me of how the
Mhm.
mom, you know, taught her how to wash, herself, as a
Mm.
young girl growing up by, making sure your hands are inserted in there to wash very, 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 very well. And I think it's most with African, women. Um,
Mm.
like growing up, they will tell you to make sure you wash well by inserting your hands in there. Make sure you wash very well by, I don't know whether maybe to clear whatever is there. I don't know, but
Mm.
to wash very, very well. And I've heard a lot of things, also on social media, women actually telling other women to do that as well. But tonight, I think you've educated us on the right things. So
Mm.
I just want you to help educate other women out there, and also to debunk all these myths, actually going out there, saying that women should be um, wash themselves well by inserting their hands right into the vagina to wash well.
Mm. So generally, most foreign things, including your fingers, do not belong in your vagina. Things that can be put in the vagina include a penis and tampons because they're made for that, speculums, as I said, sex toys because they're designed for that, and for the most part, that's pretty much it. Any other medical equipment obviously comes under that category. Your fingers, as a general rule, do not belong in your vaginal canal. There is no need for it. If you want to clean the outside, so the lips, the inner lips, the outer lips, clean, that's fine. You do not need to insert anything inside. The vagina is a naturally cleaning space. It does not need any help in that criteria. If you start introducing things in there, including your fingers, you are introducing bacteria. I guarantee you, because there's nothing that you're putting in there that is sterile. The only sterile things are the things that people like me put in there. The speculums, when we get them, are sterile. They come in a plastic bag. We open them. We put them onto a sterile sheet. Everything is sterile. Even our gloves are sterile. So even though the genitals are considered unclean, so to speak, everything we do when we touch them is sterile. And there's a very good reason for that, is because we do not want to introduce anything in there. So you can imagine me as a clinician, I put on sterile gloves. I use a sterile sheet. I use a sterile speculum. I use a sterile brush. All these things are clean because I don't want to introduce an infection into you, because that's how likely it is to introduce an infection into there, is by inserting something that's not clean. Your fingers are never going to be clean. That sex toy is never going to be clean. That penis is never going to be clean. But the latter two are made to be inserted. Your fingers are not. Your fingers have nails. They have a nail bed. There will be dirt under there. There will be bacteria under there. As normal, our skin and our nails have bacteria on them. That's normal. That's perfectly natural. That helps maintain we have a certain ecosystem on us. So the bacteria on my hand is different to the bacteria in my mouth, is different to the bacteria in my armpit, is different to the bacteria in my hair, is different to the bacteria on my feet. We have different bacteria that live on our bodies and do different things, completely harmless, don't cause us any infections at all, but they live on us. That's very normal. So I'm not about to insert my feet into my vagina. I'm not about to insert my hands into the vagina, because the bacteria that are on my hands and my feet are there for a reason. The bacteria that's in my vagina is there for a reason. It shouldn't be mixed up. You shouldn't be putting things that do not belong in other places. Any orifice is a route towards infection. Things that we put in our mouth can give us infections. So we can get food poisoning, for example. If you insert dirty things into your ears, you can get an ear infection. You insert dirty things into your eyes, eye infection. Things into your nose, sinus infection. You get the point.
Yeah.
You should not be inserting things in there because you're running the risk of infection. The very thing that you're trying to avoid by trying to be clean, you are making unclean by introducing bacteria, because nothing that you use will be sterile or clean enough than what your body is capable of doing.
Brilliant. I mean, we've come to the end of our discussion, and I think I don't have any more thing to say because Dr. Zainab has said it all. So tonight, Dr. Zainab, just to end tonight's discussion, we want our women to take their smear test seriously. Last
Absolutely.
year, for instance, I I think 4 women that I know, of, just died of cervical cancer.
I'm sorry
And
to hear that.
yes, it was so heartbreaking. And I had, like a lot of people telling me, why don't you, have a program on smear test or, like cervical, screening, just for people to be aware of the dangers of not having it done. And so tonight, you spoke to me, I listened, and I brought in Dr. Zainab to educate us on the importance of having our smear test. So please, if you are not able to tune in, kindly come back to my page, The Inside View with Nana Hagen, and please listen to this, share this link, share this video, and let it go far. And also let us own our own health as women. Let us be in charge of our own bodies. If our doctors, if our clinicians are not taking us seriously, I think we should be educated enough to tell them how we feel in our bodies. And I think, together we can get better treatment. And I just want to say thank you so much, Dr. Zainab. I don't know if you have any message out there, maybe to, I'll say, conscientize our women more on this topic, like in order to save lives. So if you have anything to say, maybe in your final remarks, anything that you want to tell our women out there, to take this cervical screening seriously, before we end tonight's discussion, please.
So absolutely. So I think the key takeaway from here is advocating for yourself. If something doesn't feel right and something isn't right, you should feel empowered enough to talk to someone in a position of care. And if you feel that you're not being listened to, you should feel empowered enough to ask someone else for their opinion and ask someone else for their help. Second thing as well is to remember that your reproductive organs are just as important as any other part of your body, and you should feel confident to talk about them. If you have any questions, you should ask them. If you want to educate yourself, there's lots of stuff on Google that you can look at that is good and valid stuff in terms of what things look like. What does this part look like? What does that part look like? What does this do? What does that do? Having a quick Google search is invaluable and infinitely better than watching TikTok, I would have to say. So generally, if you want unbiased opinions, anything that's an NHS website will be good, and you can access this anywhere in the world. If it's an NHS website, you will get good information. Another website that is extremely good is something called patient.uk. If you type in that, then it will take you to their homepage. Any condition that you have, any issues that you are thinking about, type it in and it will give you a list of search results. And that is validated information that will be accurate and is unbiased and will not contain false information for you. So, generally, having good sources of information, advocating for yourself, and also feeling confident to talk about your reproductive system in a way that benefits you.
Great. So the two sources are the NHS website and also patient.co.uk.
Patient.uk. It's changed now. Yeah. Patient.uk.
Okay, patient.uk. Okay, so if you want more information on this, yes, just like she said, one on the NHS website and also patient.uk. Am I right? Okay.
Yeah, that's right. Yeah.
So thank you so much for tonight. Thank you for your time. And anyone that had us tuning till now, I say thank you so much for your company, and I hope you've been educated. And please don't keep this to yourself. Let's share and let us empower our women out there. Thank you, and good night. Bye bye.